Hey y'all, I wanted to share with you the journey of my 21-year-old daughter. I did get permission from her before I recorded this just to make sure she was fine with it all. She did give her permission. But I wanted to share this because she has struggled with headaches for at least 10 years, maybe more, but she's 21 now. I wanted to give you the journey from birth to where we are now and who we've seen and where we're at, which I have a lot of hope, and she has a lot of hope that maybe we're getting somewhere. But when she was first born, I nursed her, and every time I'd go to nurse her, she would choke. And it was like every time I thought it was maybe I was just producing too much milk and I was choking her. That's just the way it was. And it was kind of scary, but it happened every time. Then she was a very, very colicky baby. And I thought it was a diet. I cut out my milk, cut out milk in my own diet and tried several things, and it helped a little bit when I went lactose free, but she continued to have just gas. And when we put her on her stomach, on her belly, when she was old enough to do that, she would you could tell she had a lot of gas, and that was her problem. And then as she got older and was walking, I noticed she was slunched. She always had this slunch on her shoulders and her head, and I bought her like a shoulder posture corrector because I thought, man, she's really slunched. So those were some symptoms. Then when she was about 8, she didn't have room for her teeth to be coming in, so we took her to an orthodontist. She had to do a phase of braces and then later do another phase. So she had 2 phases of braces because she didn't have any room for those teeth and just to make room there. Then as she got older, she started having headaches, and they were just constant. They're still constant. That's what took us down this journey. It's like just trying to figure out what are causing the headaches. And according to her, they never get any better. She'll have like a dull headache, and then there are many times where it will go up to a migraine to where we've had to take her to urgent care just to get a shot to take care of the pain and put her asleep for a while. Lately, that's happened quite a bit. Part of that is she's in college, which takes the stress up at times and plays a role in all that, just all the factors there. But it's the headaches that are the main thing. With that, we've seen a neurologist. He's tried all the medications. She wasn't getting any relief. We've seen internal medicine. They've done blood work, couldn't find anything. Checked her hormones, nothing was significant there. She has seen an allergist just to see if maybe she's allergic to something, and they did really deep studies to check other things, and nothing there. She did do some physical therapy. Part of that was she's had concussions, but I will say, concussions can cause headaches, but the headaches were before pre-concussion time. But the physical therapy helped some, but still didn't just take it away. So when she got to the point, one more thing I'll note, whenever she would exercise, she would always it would be really, really bad, migraine after that. But she got to the point where recently things were stressful, but her headaches from like 0 to 10, hers was like at an 8 for a week and a half. And that's what's like, we've got to do something. So I just, being a dental hygienist, I just typed in tension headaches because she was diagnosed with tension headaches. And when you ask her where it is, it's kind of, a band around her head, and you look up tension headaches, it's like, yes, that's what it is. So just tension is causing that. And so when I looked that up in the hygiene Facebook group, people started posting things about the airway, just dental airway and all the things, tongue ties and things like that. So I started researching all that, and it has been unbelievable, just the amount of information there and how legit it is. And when I see patients every day, it's like, this is real. It's just not in the books yet. Dentists aren't taught in school, orthodontists aren't taught in school, ENTs aren't taught in school because the research to confirm it all hasn't been out long enough. They say it takes 15 to 20 years to get in the books, and it's not been 15 to 20 years yet. So unless you have a reason to look into it, you don't necessarily know about it, or if somebody tells you about it. So I'm trying to tell everybody I can. But I learned about it because of the headache thing, and I've been listening to podcasts and a lot of things. So I decided I think it would be right to have Caitlin, my daughter, see an airway dentist. And because things started like, oh, that makes sense, even back from her choking whenever she was firstborn, it's like she probably has a tongue tie. So that kept her from being able to latch well. So she was choking, and that also fits with the colic that she had because she was getting air in. Because she wasn't able to close that off, she was getting air into her belly whenever she would nurse. And then the slunching can be from an airway restricted. And just like when you do CPR, you learn to lift the chin up to get the air in better. Well, your body naturally does that. When you're standing, it pulls it forward to open up that airway, which can cause the slunching. And the 2 phases of braces is because this is too small, so there's not room in the mouth for the teeth to come. So then you have to try to make it bigger. So everything was starting to connect. So we took her to Kansas City to see this airway dentist last Wednesday, and it was incredibly enlightening. He was very helpful, but they did a CBCT, which you can look that up to know what that is, but it's basically a 3D scan of the skull, and they can see everything. He can sit there and like move the image around, and you can see every angle of everything that's going on in your skull. So it confirmed that she has a little bit of a deviated septum, which is very common in my side. She gets all this from my side of the family, unfortunately. But a deviated septum, which affects the airway in the nasal area. And this is a side note, but one thing that she hates is she has a bump right here. And the doctor said, yeah, that's if you have a bump right here, that can be a sign that your body's trying to get air and your bones are just growing around that, trying to open that up. But the deviated septum, she has a grade 3 to 4 tongue tie, and she has a lip tie. All that can affect the fascia, which is connective tissue, which makes things tight. All this can be tight. And she has a retrognathic jaw. So her jaw, and she gets it from me, but if you look at the side, this is set back. And ideally, there'd be a line where this would kind of be straight and then be forward. Well, hers, looking at her, you don't see it, but her jaw, and mine would be too, both upper and lower, are so far back that the tongue would, if this was forward, the tongue would be more forward. But because it's back, the tongue's back, so then it settles at the base of the tongue back here. So where the airway space, if you were looking from the side, would be, kind of wide. And then when the tongue's kind of gathered back here, it makes it more narrow. So her airway space is very narrow. And I had been doing it. I didn't think about the jaw at all. I'd been doing the research on the tongue tie and things, and sure enough, she did have it. So I was like, well, if we clip the tongue, would that just help with some of the tension? And he said, well, the problem they're finding now, if they do that too soon, then the tongue is looser and can fall back even more, creating even more of an obstruction. So we want to wait until there's room for that. But one of the big things this all affects is it can cause sleep apnea. So we had her do a sleep study, and it was a home sleep study, and did it for 2 nights. The first night was like insignificant. The second night she had a 3. You have to have a 5 for, it's kind of like a rating. A 5 is mild, and then it goes up to moderate, and then goes up to severe. Well, we had talked about that, and he said, as young as she is, she has that obstruction. So she would have sleep apnea in a sense. Even if it's not apnea, it's an airway resistance. So apnea is where you're holding your breath, which means your airway is totally closed. If it's an obstruction or resistance, obstruction closes it. Resistance can be just that it's narrow, which means you're still not getting the flow. It's backed up there, not flowing the way it should. And so you may not fail a sleep study, but you still have some kind of struggles there getting the oxygen you need at night. For her, he said this, and I looked at the sleep study. We had it printed off because my husband wanted to see it because he's a sleep tech and he knows all about this. And he said, her sleep, because she's young, her body's not letting her get into a deep sleep because it knows it's going to have an apnea. It knows it's going to hold the breath, or the hypopnea, the oxygen level will drop. And if you look at the sleep, it is light, 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 light. And then when it goes deep, she has a hypopnea, and she wakes up, and then it's light, 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 light. So most of the night, she's just getting light sleep. She's never getting that deep sleep that she needs. And so it may not show up because she's in the light sleep. She's not having the apneas because her body's not letting her get deep sleep. So she's just spending all this night without deep sleep. So she's tired throughout the day. She falls asleep, want to go on trips all the time. And that's what's making her, it's causing a low pain tolerance. That's my conclusion, because she has a very low pain tolerance. And when your body is in constant tired state, it just stimulations, it can't handle well. And she startles very easily, which one of her concussions was from a startle that caused her to fall back and hit her head on the corner of a fireplace. So her startle is just very extreme. So all these things in her life, it's like it all makes sense now because of the airway issue. And the tension too is the whole forward posture can affect the neck, the muscles right here, because when things aren't working or where they're supposed to be, then there's this strain and overuse, and that causes pain on the muscles. There could be a relationship there also with the tongue tie and the fascia being tight. There's just no way to know. She has all these myriad of things going on. So the prognosis, well, the diagnosis for, according to this airway dentist, is she needs, it's called MMA, and it's maxillary and mandibular bringing forward, anterior, bringing it forward. There's a, anyway, that makes more sense if you look it up. And you can actually look up surgeries or videos of people who have had, or pictures of people who have had it done. So where they have this set back, they bring it forward, which brings the neck forward. And you can actually see on the skin right here, on some of them, they're like that. And then they bring it forward, makes you look really thin. But it brings that forward, so when it does that, and you can just feel, if you try it on yourself, it kind of feels different. Kind of, you can feel it opening up that airway. But it pulls it forward, so then it gives the tongue the opportunity to come forward and then release that airway restriction. And I've seen pictures, if you look up CEPH, like CEPH, which just means a side view of an x-ray of MMA. You could look that up and you can see the difference of how it opens. And so he's recommending that she has that done. Once she does that, then we could do a tongue tie release. If she has that done, she's going to have myofunctional therapy, which I'm registered to start in May. I'm super excited about that. But she'll have the myofunctional therapy because the tongue will just keep doing everything it's always done, because that's all she's known all her life. But once you release that, you have to do it, train it, stretch it, and then that gets that muscle doing what it's supposed to do. But if I had to guess, she's probably going to have to also have some kind of physical therapy, or some call it body work, because she's always slunched. That's all she's ever known. So she's going to have to work on training, getting those muscles where they need to be so that everything's straight, so those muscles are not pulled forward anymore. So the sad thing is, insurance won't cover that surgery because I think probably to them it's cosmetic. But the only way they would cover it is if she fails a sleep study. So like I said earlier, we did a sleep study at home, and she didn't get to a deep enough sleep. Her body wouldn't let her. So they just look at that and go, oh, no, she's fine. But we are going to do an in-lab sleep study, which chances of her sleeping aren't going to be great because you've got all these wires hooked up and you're in a different place and things. But we asked the doctor to prescribe her an Ambien, which is a common pill they do for sleep studies, just to help people sleep in that. So we're hoping that will help her get into a deep enough sleep that she can stay in a deep sleep, so that what's really going on will become evident. But we'll see. Otherwise, we might be paying for this out of pocket. It's going to entail getting some braces on to give the rubber bands to help her when she's healing from the surgery, give them a place to hook on to, and then when the surgery's done, she's going to have some kind of like Invisalign to move her teeth to where they need to go again. She'll have to have myofunctional therapy, which at that point I should be trained to do that, and a whole lot of other stuff. So this could have been prevented had orthodontists and people known about this. If I had known about this early on, so now I'm looking at all my other kids like, oh, what can we do now to keep them from getting to this point? The reality is I need MMA because of the way I'm made, but I don't have symptoms as far as the headaches or anything like that. I never have, but I will have to be on a CPAP machine, or unless I can get something done by, well, maybe even now. I probably need one now. Now I'm very mindful of it when I'm sleeping. But yeah, I just wanted to give you all that information. It's been amazing to see that everything now is making sense in her life, and we're hoping, the doctor was pretty confident that this could help with her headaches. Even if not, I asked him, I said, you know, what if we don't go through with the surgery, what are the options? Like, well, the reality is we're just going to be chipping away for the rest of her life, because all these things are causing some kind of issues with her. And she'll be on a CPAP for the rest of her life. So she's only 21. So we do want to get this fixed and get it fixed right. And it's going to be a long journey. The surgery itself, I did want to mention that because we have, I know like even the deviated septum, if she were to have that corrected, which maybe they can do that when they do the MMA. We had been told with my oldest daughter, who I wish we had had this fixed at the time, but it was this horrible surgery, horrible recovery. They pack your nose. And now talking to him, he said, it's at least the guy he saw, it's not that bad anymore. And they don't pack the nose and things like that. So that's not as bad as it used to be. Doing the jaw surgery, they used to like wire your mouth closed and you couldn't do anything. He said, it's like a 2-week recovery. So it's not that bad for a lifetime of being able to sleep well and not have to deal with all this. So it doesn't sound horrible. It's the price tag. That's going to be really hard. We're waiting on that. And again, hoping that maybe we can get insurance to help. What's crazy is that insurance, they're having to pay all the time for her medical bills because she's always going in for one thing or another because of the headaches. And if they could just pay for this one-time thing, not one time, but, you know, period of time, then that could potentially alleviate those health issues. But here we are. Anyway, if you have any questions, you can comment. I'm planning on continuing to share this journey because if this can be of help to anybody else, and I will say, I know she's not the only one because I have talked to patients who have had no answers. And when I share what's going on with my daughter or symptoms, they're like, that's exactly where I'm at. And I just want to get the word out there that there is reality in this whole airway dentistry thing. You can just look up, myofunctional therapy, just look up any airway dentist. If you find their website, a lot of times there's information on there. And yeah, you can find a myofunctional therapist near you, or you can wait till I'm done in September of 25 and contact me, and I would be more than happy to help you try to figure out what's going on if y'all have similar issues. So thanks for listening. Bye.